during Grishma Rudu more, isn't it? Risk in hot, humid environments, I think. Stress and overweight is a factor. But please listen, this is having diverse presentation. I will show the diverse presentation. Here you can see it is somewhat like our lesion, okay? Isn't it or not? This is the diverse presentation of Tinea corporis. Okay, it is not a circular lesion, almost circular lesion, not completely circular. Or this is different lesions of the same Tinea corporis. Okay. Okay, here also we can see. Clear? There is a middle portion also. A circular erythematous lesion and somewhat middle portion also there is. So, what are your treatment options? You can tell your treatment option. Which type of lesion is it? Doshic predominance. And what are your treatment options? You can answer. I think you are more enthusiastic to answer. You can tell. Kapha Pitta. Okay. In the last class, I have told that I don't want clinical explanation. I want the medicine in your hand. I want the name of the medicine. Okay, concept is in your brain. No, I don't want the concept. Concept should be on your brain and answer should be on your pen. Aragodadi kashayam. Okay, tikta kashayam, gandhagarasayanam, tikta gradam, kadirarishtam. Why? Why? Manjishtari. Okay, okay. So the treatment options, it is a kapha pitta lesion. It's okay, no problem. Itching is there. Pitta, basically itching is also there. Pitta is there. Tokroga is there. So pitta, you should consider pitta, kabaja, kaba pitta shamana. Okay. And it is a lesion. Guluchadi kashaya and manjishtadi kashaya, you can opt. If severity is more, go for manjishtadi. If severity is less, go for guluchadi. I have explained the classical triad of Tokveda. Tokveda triad. Guluchadi kashaya, Vilwadi gulika, and Avipatti churna. You can go with that. Okay. Otherwise, you are here also some options are there. It is a ringworm infection. Okay. You are knowing the concept of krimi. Have you applied it anywhere? Have you applied it anywhere? What is krimi in our concept? What is krimi? You can also give krimic navadi. Okay. There is another option, krimic navadi. You can give, I am giving krimic navadi also in some cases. If it is severe bacterial or viral infection, we can go for krimic navadi rather than vilwadi. That's my answer. You can also go for Dushi Vishari. Dushi Vishari Gulika is also a good option, which is mentioned for Dushi Visha. But when aggravated, we can go for this. Oh, okay, Gobi Chandra. But I'm telling the concept. And Avipatti Churna. Basically, Pitta is there. Yeah, you can see it is a reddish erythematous lesion is there. So surrounding it is spreading lesion. So you want to go for a Pitta Shamana drug, especially Avipatti Churna is best here. And for external application, it is not a oozing type, isn't it or not? Whether external application can be given or not in this lesion. Needed or not? That's the first question. Whether external application, yes, no. With internal application, we can cure this disease. Okay. It is not Krimikudara. I am giving only in the normal Krimiknavadi. I will give the reference after the class. Okay. So basically, in my concept for Tinea infection, basically, if it is not an oozing type, you can go for external application. And external application is also a important thing in skin diseases regarding this condition, Tinea, especially for fungal Tinea infections. Okay. So what I have given is this. Okay. This is the treatment options you can take. And this is a treatment that I have given in this case. Why? Because this patient is not willing to take a Kashaya. That I will tell. Okay, I am asking that this kashaya is coming to my mind. Okay, one kashaya is coming to my mind, but I am asking that patient whether you are able to take kashaya. I will ask each and every patient who is coming to me to whether he can take this medicine or not. What is the importance of that question? Anyone? Whether you are asking this to your patient or not, or you are writing your own prescription. I am asking this question. How many of you have tasted kashayas, especially Panjatikta kashaya? If you are not knowing this answer, taste Panjatikta kashaya tomorrow itself. Then you will not ask. You will ask this question every time. If you are not having any options like that, taste Panjatikta kashaya tomorrow itself. Then you will ask this question in each and every class, every patient. Okay, that's an important thing. Okay, if you are not able to take a medicine, how you can make a patient to take that? That's the answer. So that patient is not willing to take. Okay, don't tell that that patient is not in like Chamundi patient, or you are telling that it is not a Vaidya Vihina patient. Okay, no problem. But the patient is coming to me and he is telling, and he is okay with the, and he is telling that I will take kashaya is a problematic problem thing for him, and he is telling, okay, baki I will accept. Then I am giving Ayurvedic churna, half teaspoon in night with honey for as a shamana, and sourcet ointment. This ointment is very much effective in these type of cases, in my according to my experience, which is a product of Aushadhi, which is a government product, government of Kerala product, Aushadhi. It is very, we can search in, okay, sourcet ointment is very much effective in these cases and psoriasis. It's very much effective. Okay. Honey, I'm giving it as an anubana, not with water. Kapha pitta shamana. For pitta, honey is a good thing rather than taking it as with water. Basically, pitta shamana, honey is very much effective in avipatti. Clear? And sourcet ointment for external application. Vilvadi guliga. Patient was not willing to take kashaya. Clear? That's the first visit. And after 1 week, the patient was again coming, and it is the difference was a very little bit. So the patient was again asking to me after 1 week. I am giving medicines for basically for 1 week, and after 1 week, and that's the question. In which cases you want to ask the patient to come after 3 days? What is your pattern that you are following? Whether the weekly visits or daily visits or monthly visits for each and every practitioner weekly. Yes, weekly is very good. Okay, so which are the cases in which you want to ask the patient to come within 3 days? After 3 days, some are also doing like that within 3 days in acute conditions. What are the acute conditions? Especially one disease is there, especially when it is a rash associated with a fever. Basically, fever cases. When it is a rash associated, it's not pruritus. You can call it. Is mobile is there. It is available with you. The patient will call you. You can get the feedback through the phone. I am giving phone number to each and every patient. I am getting the feedback through my phone itself. Okay. Visit only within 1 week, but after 3 days during a fever case, I am telling about not acute condition, communicable disease, especially like any fevers, dengue, okay, or chicken pox, okay, and during phone also, within 3 weeks, okay, 3 days, you want to get the feedback, not directly through phone. Otherwise, in communicable disease also, for example, if dengue fever is there, the patient is diagnosed with this, and it is not the final stage, the first 2 stages. So we want to check the status of the blood, or we want to communicate with the patient within 3 days. We want to check it. All the disease which are having mumps, same effect. Mumps is also having the same. Okay. This is my answer. For this, I am giving 1 week. And after second visit, I am giving this patient. The patient is coming to me and asking, okay, sir, I will take that kashaya that you are mentioning. I'm not having any problem. Otherwise, it will sometimes be increasing really a problem. So he is giving. I was asking and I am giving this kashaya, which is Guluchadi Kashaya Churna. This is coming. The classical triad is coming to my mind at that time. But I am giving Guluchadi Kashaya not in the form of bottle kashaya. I am giving the powder itself. And in this way, I am making 1 glass kashaya churna. Okay. Kashaya, 1 glass kashayam before and after food. It is in this way I am giving, but I am preparing the kashaya. 1 spoon kashaya churna mixed with 4 glass of water, boiled in 4 glass of water and reduced to 2 glass. The patient will prepare this kashaya in the morning. You're getting 1 spoon kashaya churna, 1 teaspoon. Okay, tablespoon, not teaspoon, tablespoon means 110 gram. Okay, 10 gram kashaya churna in 4 glass of water, reduced to 2 glass. Boiled and reduced to 2 glass, and 1 glass in the morning after food, 1 glass in the evening after food. This is the pattern that I am following. The same Baki rest, I am following the same treatment itself. Okay, after 2 weeks, I am taking. Okay, it is somewhat reduced. No problem. Itching was severely reduced. Okay. No problem with itching is severely reduced. And I have seen even where only single pruritus itself, single itching itself, the best medicine is Villuadi and Avipatti. You can directly go for pruritus if you are not knowing the causative, but you want to check the causative factors like whether the bile salts are increased, whether ammonia is there, whether urine kidney related problem is there. You want to check for the associated symptoms for, and if you are not knowing anything, you can Sukshma Churna also we can reduce. Okay, Sukshma Churna, if you are taking Sukshma Churna, this is not Sukshma Churna. It is Kashaya Churna itself. It is coarse type of Churna. And if you are taking coarse type of Churna, you want to take like this. 1 tablespoon Kashaya Churna boiled in 4 glass of water, reduced to 2 glass. And if you are taking Sukshma Churna, Everest is having Sukshma Churna. It is very good, effective, and in according to my practice, it is easy that you can boil 1 spoon. 1 teaspoon is enough, or 1 tablespoon you can take, no problem. In 2 glass of water, reduce to 1 glass. It is enough. Clear? You want to just boil like you are boiling tea. Sukshma Churna. It is somewhat like tea. Aushadhi is having Kashaya Churna, and Everest company is having Kashaya Sukshma Churna. And according to my practice, the best thing is Kashaya Sukshma Churna. Okay. If the patient is diabetic, okay, Avipati Churna, you can go for Triphala Churna also. You can go for Triphala Churna also. Or you can go for Nimbericinia the tap. If the patient is diabetic, you can go for one Nimbericinia the Churna is there. I think cortical. I will give the reference. You can, Rahul, so please mention that points and I will give that. Nimbericinyadi is a good medicine. It is a good option here in diabetic patients. Clear? So we can move forward. This is a classical triad. Especially this is a classical triad, Guluchadi, Avipatti, Villwadi. If you are not knowing anything regarding skin disease, if you want to check for 1 week, you can give this. No problem with that. Check whether the patient is diabetic or not. Nimbericinyadi internally. I'm telling Nimbericinyadi internally. Dushi Vishari also you can give. Why? Because if you are thinking that it is a, why not Arakudadi? Arakudadi is given for which condition? For me, for according to my experience, I will tell one case is coming. It is if it is a blackish hard lesion like that, Arakudadi is the best option. If it is a oozing or non-oozing type, which is reddish, pinkish, it is mainly Kabaja condition is there, but Pitta is also associated. Pitta is having predominance. Erythematous lesion is there. I will tell it is coming. Nalpamaradi Taila. According to my experience, this Sorset ointment is rather more useful. You can also go for Gandhaga Malahara. Gandhaga Rasayana is more good than Gandhaga Malahara. The second option for external application, according to my experience, is this Gandhaga Rasayana is having good effect. And you can also go for Gandhaga Malahara. It's a good option. Gandhaga Malahara. 6C ointment. One ointment is also there. 6C. It is also very much effective. 6C. It is coming. In next case, I think it is coming. If you're having any problem, you can directly ask. Yeah, Gugulum Marijadi Thailam is also good, but oil application in fungal condition, you want to check. Gugulum Marijadi is good. Good. But sometimes in some patients, I have seen aggravation is there. That's why I'm not confident so much to take an oil there. Rather than ointment is the best option which is available. In my experience. Trichodome is also good. Yes, trichodome is also good. But if you are getting one medicine which is very much effective for you, then you will continue that medicine itself, isn't it? I think all your doctors will support that. Yeah, Kasisadi is also good. Yes, you can directly tell, no problem. I'm just telling. Clear? So, one question was there regarding Arogadadi. Yeah, Vinsoria oil is good. Vinsoria oil is good. 777 oil is good. Gugulu Merijadi. Yes. And in some condition, Gugulu Marajadi can be given. For example, it is an lesion of your scalp region. We can't go for ointment. It is basically the oil which is used. That's why. Kanjitele can be used, but I am telling on my own experience. Okay. Yeah. Mahamaricharya. So the importance of dosha assessment of the patient. I think in the last class I am just telling. And Kashaya, okay, one more option. If we are not knowing about, even you can give Kashaya, Nimba Kashaya, but it's a problem is that Padola Kaduroni can be given. I am not doing Rokshana externally for this patient. I am directly going for this. I am just giving this medicine from my own side. Okay. So importance of dosha assessment. This is a message that I want to convey. Message number 8. So what is the importance of dosha assessment of skin lesion in dermatological cases? I think you are knowing now, you can tell from your own side. Skin lesion, you are knowing that I have explained kushta, kushna, the texture of the skin is lost. Hence, it is called kushta. It is a samanija vyadhi, isn't it? Samanija vyadhi means which is having the kushnatva, means the skin texture was lost. That's the kushnatva is the main feature. There will be vada, pitta, kaba, kushta. But basically, the main dosha is there, which is responsible for kushta, which is that pitta. You want to check every time pitta. This is an important concept that you want to check regarding dermatological cases. The main culprit is there, pitta. Clear? And one more thing. So check every time pitta, first of all. Okay, the main dosha is pitta. The main dosha is the second thing. You want to check rekta. Dosha, rekta. You want associated doshas will be vada and pitta. Why? Because samanija vyadhi. If it is blackish, my concept is that blackish lesion, you can go for with vada. If it is a reddish, pinkish, or coppery type colored lesion, pitta. If it is whitish or skin colored, mostly it will be kaba. And regarding the color, I am telling, if it is associated with itching, kaba. If it is associated with pus, you are knowing that pitta kaba rekta. You are knowing that lesion. Okay. Puya kaba rektatum. You have studied all these things. Hard keratinized swelling, vada kaba. If it is associated with inflammation, pitta kaba rekta. If it is associated with dryness and pain, vada pitta, you have seen in that psoriasis case. Okay, every time we can. It is a type of what do you tell? It is a type of combination and like that. Okay, clear. Reddish oozing lesion. If it is a reddish oozing type of lesion, the most option will be manjishtadi or mahamanjishtadi. Or you can also go for okay. And if it is a pus-filled lesion, Kadirarishta is useful in Kushta in acute condition. Can it be preferred to all Kushta patients? If you are prescribing Kadirarishta to a patient, you want to check whether the prakriti of the patient. If, in some Pitta prakriti patients, Kadirarishta is having a problem. I am giving Arishta in the form of, I am mixing Kadirarishta with Aragudarishta. This combination is very good, effective. According to my experience, I am mixing either Kadirarishta with Aragudarishta. And I'm giving only 10 or 15 ml. I'm not giving in the first visit, only giving in the second visit. Okay, mostly. Yeah, Siddhartha Snana can be given for all Siddha Kushta conditions, but if it is a spreading type of lesion, you want to check it a little bit, especially communicable disease condition. Yeah, Kandu will be there in Vada also, how to differentiate Vada and Kaba. Okay, Kando basically it is Kabaja, but if you are, when I have explained the different concepts of Vada, Pitta, and Kaba, you want to check the status of the patient also. You want to check the Koshta, you want to check those status of the patient. That's why I am asking to ask different lesion. If it is a problem with Bhakti, okay, you want to check those problems also. And in lesion, basically, if it is oozing type, Kaba Pitta will be there. If it is Kandu, more Kabaja Pittaja involvement is there rather than Vada. Vada, it will be Rukshada more. With, okay. Drakshadi Kashaya can also be given, but Drakshadi Kashaya, the best option for giving Drakshadi Kashaya is basically diseases like Pandu. Okay, rectal involvement in which pitta, the quality of pitta is reduced. It is drakshadi kashaya can be given. Like recta pitta, you can even give drakshadi panda, or pandu, you can give drakshadi kashaya. It is coming, prurigo nodularis is coming. Okay. And it is a blacky itchy lesion. According to my experience, I am telling, okay, don't tell that it's okay. It is on my experience, I am telling. Pus-filled lesion, it is, you want to go for high, heavy kashayas like Mahamanjishtadi or Punarnavadi. Whether Punarnavadi is Kaba Shamana or Pitta Shamana. What is your answer? Punarnavadi, I think everyone is giving for Shobha. Whether Punarnavadi is Kaba Shamana or Pitta Shamana. Pitta, Kaba, Pitta, Kaba. Okay. What is your answer? Okay. According to my experience, please, Punarnava Nimba Padole Shundi Tiktamrta Darya Bhya Kashaya. Please, the drugs itself. Punarnava, Pitta Shamana. Nimba, Rather more pitta shamana. Okay, pununava nimba padola. Shundi only is kapha shamana. Baki. Pununava nimba padola shundi tikta amrda darvi abhaya. Okay, abhaya is somewhat kapha. Baki all the tracks most are tiktarasa dravya, most are pitta shamana. That's why it is a good option in all the oozing type and kabarekta pitta conditions. Okay, pus filled conditions. You can get the answer. The yoga will give the answer for you. Okay, please study yoga as such. Don't study yoga as a sloga. So you can write it. You can make a permutation combination of the yoga. Then we will get the answer for each and every dosha. Clear? When sir, sometimes I have not. And Ushna and Tikshna guna of Pitta is increased. If Ushna and Tikshna guna, Rokshada is there, then you can go for Snigdha Virechana options. You can go for Snigdha Virechana options. White scaly skin lesions which have dryness and itching associated with this. You can also go for Grudha options. Guglu Tikta Grudha can be an option there. You can go for that. Okay, otherwise you can go for Eranda Taila. Like that you can go. No problem. White scaly pleuritis is there. Guluchadi is the best option. Had keratinized lesion, Gugulutiktaga. Okay, it is a good option, but I have mentioned that Gugulutiktaga cannot be given for a young lady having the age of reproductive age, and it should be given along with Tribala Churna, according to my sir, Balakrishnan sir. He is telling that one teaspoon of Tribala Churna is there. He is telling like that. Okay, and I'm not giving Guglediktaga Kashaya for any of the patient. Mostly, it is a rare medicine for me. In case of hypertension or cardiac, okay. For hypertensive patients, okay, cardiac Kashayam itself, please listen. Don't give Kashaya that more or high concentrated Kashaya for a cardiac patient. That's the answer. I am not giving Kashaya for a cardiac patient. I'm not giving. Yeah, this is but because it is mentioned in the Kashaya Adiyoga, you are knowing that Kashaya Rasa Adiyoga. If it is a Kashaya Rasa Kashaya or Tikta Rasa Kashaya, please check it. Hridroga is mentioned as an Adiyoga of excessive use of Rasa. Okay, so please listen, you want to check. Yeah, in a Pitta Prakriti patient, you want to check Guglu Tikta Kashaya. Why? Because Balladag is there, and if he is having, please ask about the allergic condition of that patient and check it. You can check the skin. You can touch the skin of the patient, whether it is some patients are having, whenever it is touching, it is getting reddy or sometimes itchy or sometimes pinkish. So don't give, that's the answer. You want to check the patient. Patient analysis is very much important. That's why Ajarya has mentioned that importance is diagnosis, first of all. Clear? I think this is the answer that I given. In for each and every patient, it is different. I can't give since scalp psoriasis. What should we think? For psoriasis, the best option one for me, according to my experience, Sorset is also having an oil option. Sorset oil is very good. Okay, and that Ayyapana Keratailam, it is also very much effective in scalp psoriasis. If it is not an oozing type, in oozing type, I'm not giving any of the external application. I am giving internally. After that, if after this oozing is subsided, I am giving going for external. This is my experience. I am sharing. Okay, I'm not giving any external application when it is an oozing type. Kashan tablet of Manjistadi Gulichadi, yes, you can give, but you want to give 2 tablets. Those tablets are very much okay. According to me, it is less effective compared to, according to my concept, my experience. The most effective is Kashaya Sukshma Churna, then Kashaya Churna. Most effective is not Kashaya Sukshma Churna. You are knowing the packets of Kashaya drugs are, for example, Punanava, Nimba, Padole, Shundi, Tiktamra, Darvi, Abhaya Kashaya. You can get it single piece of 5 gram. For example, if you are getting writing Punanavadi Kashaya packet, okay, you will get 50 gram of Punarnavadi Kashaya. Okay, for 1 week. For AP, and you want to make it Kashaya. That's the best thing. Okay, raw drug Kashaya is the best Kashaya that I have used in my career. Second is Kashaya Churna, Kashaya Sukshma Churna. Next effective is Kashaya Churna. Then it is Kashaya, then Kashaya Tab, according to my experience. Yeah, Winsori is also good. Winsori is also good in this condition. Clear? Can we move forward? So next, if you are having any doubts, you can ask. Okay, no problem. So we want to know the knowledge of other similar conditions. So for the students, I'm basically telling this: whenever you are sitting on your OPD, if you are getting a case like tinea corporis or like that, you are knowing dadru. So many options are coming into your mind. So you want to for every student, first year or second year or third year, or even house agents, interns, PGs. I'm telling this: you want to have a doctor's diary with you, and you want to write each and every case. Every case is unique. Whatever the symptoms, you write it. Whatever the teacher is giving to that patient, you write it, and you ask why you are giving this medicine, sir or ma'am. And after this, I am making this, and after your house agency or like that, you can make a protocol of your own. In this way, I am making, all the teachers are giving me that guidance. Clear? That's why you can have an idea from. And there are similar conditions. Tinea pedis is there, Tinea unguium is there, Tinea cruris is there, Tinea capitis is there, Tinea nigra is there, Tinea. Whether you are knowing all these things, yes or no? I think some are knowing that. Pedis, what is pedis? Fissuring or scaling or maceration of interdigital space. I think you have seen these cases in your copy. What you are writing, diagnosis, I want that answer. What you are writing on your case sheets, tinea pedis. It is beautifully mentioned in our classics. What is the answer? Yeah, it is mentioned. Okay, it's called athlete's foot, alasa, alasa. Okay, malodor pruritus is there. It will be mostly affecting third and between third and fourth and fifth, basically. Okay, you can see tinea pedis. And it is in three forms. You want to know the basics of these things. Intertriginous or acute vesicular or mocassin type. Three types are there. Macerated, boggy, white, thick, odorous. It is called intertriginous. Acute vesicular means it is an inflammatory type, fissuring. Bacterial infection was also there, which leads to pruritus. Mocassin, it is chronic, non-vesicular over plantar foot. Okay, and it is mentioned beautifully in our classics as alasa. Kshudra Roga. It is mentioned under Kshudra Roga, which is associated with oozing and itching present in between fingers of leg caused due to muddy clay. You are knowing this logo, I think. Dushta Kardhama Samsparshat Kandu Kleda Nidanandara. Kandu Kleda Niyandara Angulya. It is between Andara Angulya. In between the Anguli fingers. Kandu with itching. Kleda with oozing. Dushta Kardhama Samsparshat due to muddy clay or water. It is called alasa. In Ashtanga Hridaya, Uttarasthana, Shudraroga, it is mentioned. Clear or not? Clear or not? Now I think you can diagnose it as this thing. Hello? Am I audible, Rahul sir?
Yes, sir, you're audible.
Okay. It's clear or not? Till this point. Can we move forward?
Yes, sir.
So what is the treatment for Tinea pedis or alasa? How many of you are writing it as alasa? How many of you are writing it as alasa? I think you're writing or not? I want that answer. Not now. From tomorrow you want to write. That's the motive of this class. That's all. Clear? It is mentioned in our classics. We can take this. It is not modern or Ayurvedic. Okay, that's why we are studying Ayurveda, isn't it? But you want to know the modern aspect also. What are the treatment options that you are giving for this case? What are the treatment options that you are giving for this case? Please, from your side. I can get also good answers. I can get good options. You can treat according to your experience also. You can tell. It is a knowledge sharing. Okay, I am not a radio. Okay. Okay, Vranarohini, lotion, Gulichadi Kashaya. Okay. Oozing type may we can give external application. For sure, Gugulu. Okay. Guluchadi Kashaya. Okay. Okay. Good. Okay. Grab capsule. Okay, it's not a good option. I'm seeing for the first time grab capsule. Okay. So according to my experience, I am treating on the basis of this type of a mocassin type. Mocassin type, I have mentioned that. Okay. What is mocassin type? Uh, It is chronic non-vesicular. Okay. If it is non-vesicular, I am giving external application basically. Okay. I am giving only external application basically. It is easy. Burn cure ointment is best. Burn cure ointment is an ointment application of Aushadhi itself, government supply. It is very good, very much. It is basically for burns, but it is very much effective in these cases also, according to my concept. Raswatamadi is also a good option. Raswatamadi leba. Okay, and one Murivanna installation. How many of you have done Murivanna installation? I am not telling about oozing type. It is only about non-oozing type. Okay, this moccasin is a non-vesicular, non-oozing type. In that, I am applying this external base. Okay, Jatyadikrita. Jatyadikrita is having a problem. What is the problem is that it is run a Shodhana Robana. So whenever it is having some problem regarding Shodhana, it will do Shodhana first, then Robana. Sometimes in some cases, I have seen cases in which sometimes Jatyadikrita is aggravating the disease. Why? Because if something, there's some dead cells or something is there, it will make Jatyadikrita is having this problem that it will make Shodhana first, then Robana. If it is a stage of Robana, it will heal easily with Jatyadikrita. But if something is there left behind, Jatyadikrita will make it worst and put it out. But the patient will tell that my symptom is aggravating. Clear? I have experience like that. So burn cure ointment is a good option. Rasotamaji leba is a good option. Somaraji Taila is a good option. Murivanna instillation, this is given by a patient. What happened is that Murivanna, how in which way you will give? With in cloth, plain cloth. Don't use gloves, the cotton there. It's very much problematic. Either small, okay, copper sulfate. Okay. Marijuana instillation is very good. I have experience in some cases. It is very much effective. Marijuana ointment is also there now available in the market. It is also very much effective. In intact triginous or acute vesicular, that is oozing type. Okay, oozing type and vesicular pustule type. Vesicular type, I am giving internal medication also. Guluchadi or Manjishtadi with Avibhati Churna, Vilwadi itself. The classical triad is very much effective in this case. Yes, Gandhaga Rasayan is almost effective. Gandhaga Malahara is also effective. Clear? I think. Okay or not? You're getting with this class. I think you are thinking like that. I think so. Tinea unguium. How many of you seen this case? Next case. How many of you have seen this case? Have you seen this case? Thick, rough, yellow, opaque, and friable. The nail, okay, nail become thick, rough, yellow, opaque, and friable. Have you seen this case in your life? Yes, okay. Those who are telling us what is your diagnosis, what you have written in your case sheets. That's why I want that answer. What you have written in your case sheets. Not got good result. That's not a problem. We want first of all diagnose, then treatment. Treatment. If treatment is not good, no problem. How many of you written like that Kunaga and that time, or you are writing like nail disease or the modern? Okay, ongomycosis. Okay, nails lose the normal shiny luster. Cannot be treated with topical non-prescription drugs. Modern में क्या है? In Ayurveda, Krishna abhikhadat rukshascha karascha kunagho nakha. It is clearly mentioned, isn't it or not? Please listen the modern point. Please, I am not correlating with modern point. Don't think that I am a modern Vadi. Okay, I am not correlating. Don't think like that. Okay, it is mentioned in a classic. I am. Please check the condition of the nail and write it. Okay, infection itself, it is mentioned there. It is a type of onychomycosis. Okay, basically infection is there. Krishna bhikhada rukshashcha kharashcha. Khara is there. Okay, Krishna, sometimes blackish will be there. Abhikhada, mostly sometimes in Ayurveda it is mentioned as abhikhada. Okay, sometimes it will be causing like that. Rukshada and karatva is there. The best. How many of you have got good results? Please tell the answers. For me, it is not completely curable. I'm truly speaking. For me, it is not completely curable. I have got results in only 20% of the cases. I have got results in only 20% of the cases. Baki 80%, it is not completely external application of henna. Okay, I can reduce. I could okay. I am asking completely curable. If you are telling that you are confident in that, you would want to be completely cured. You are making it as a relapsing thing, no problem. It is not a treatment. Modern is also treating prameha. Okay. Removal of the nail. Rasotama, leba and Morivenda ointment for external application is somewhat effective. And in internal Guluchari, Pravala Basma is also effective application. But according to me, it is not having complete cure, and I have not a good experience in that. Okay, and truly speaking, yeah, clear. And why I'm asking some question also. If you are not treating it, okay, how many days you are treating a patient basically? For how many weeks or days you are treating a patient? Kushta has reached Asti. Yeah, you can go for that line of management, but I am not getting results there. That's why. Yeah, Pramala Basmam internally, not externally, internally. You're getting the concept. Asti is the Naka is the Mala of Asti. The same Kalakapodhanaya. Sorry, Kedara Kullinaya. Sorry. One mandala. For how many days you are treating a patient? You are keeping a patient. So according to my concept, I am treating a patient basically for 1 week. I am reviewing, and for 2 weeks I am reviewing. After 2 weeks, if the patient is not having good results, after 1 week, if the patient is not having, sometimes most of the patients are having results. If the patient is not having result, I will change one or two sometimes medicines, but mostly I will continue the medicines for 14 days. If after 14 days, if the patient is not having good relief, I will change the medicine. And if the patient is not having good relief after 21 days or at least after 1 month, I will refer that patient to any other good doctors or any other means modern medicine doctors, basically to Ayurvedic or modern. Why? Because if the results is not there, I am not able to treat that patient. That's my answer. Okay, it's not the fault of Ayurveda or not the fault of the medicine. It's the fault of me or the disease is has an Asadhi disease. Isn't it or not? How many of you are treating like that? If the patient is having results, okay, no problem. You can treat. But no, if it is no, okay, how many of you are following this? Please tell that. How many of you are following this? Otherwise, the patient will be going, isn't it or not? Some patients are also telling like that, but mostly more than 3 weeks. If the patient is not having result, this is the message that I want to convey to you. Okay, clear? Tinea cruris. How many of you are knowing Tinea cruris? I think one patient is telling one. Okay, someone is telling Tinea cruris. Okay, it is basically, I think you have seen jock itch or underwear itch. You are knowing slightly elevated erytheromatous, same lesion, but it is seen in vesicles will be there. Acute lesion, more bright red. Okay, and sometimes chronic hyperpigmented. Chronic lesions will be blackish or hyperpigmented, but acute lesion it will be less pigment, reddish or pinkish, isn't it or not? I think you have seen this is more common in Grishma Rutu, isn't it? Jock itch. The area is different. The area is thigh, pubic area, medial and upper part of thigh or pubic area. Sometimes it is not affecting penis and scrotum. You want to check it. Clear? Bilaterally, mostly bilaterally. Sometimes it also one side, but mostly bilaterally. What is the reason? Well demarcated margins. You can see. Okay, and what is the treatment? What is your answer? In tinea infections, especially the dadru. For me, it is not so problematic. I think I have got good results in the dadru. Whether it is diabetic or non-diabetic, I have seen so many cases in the same pattern in tinea pedis. Tinea corporis. I have got good results. External application and with internal medicines. The same treatment I am following. Most of the cases it is having good results. Okay. You can see the different presentations. How many of you have seen this case? What you are writing in your case sheets? Whether I want to move it faster, Rahul sir, I think it is 1 hour. Whether it is okay or we want to increase the speed of this presentation, that's why I'm asking.
Sir, I think I
I-
can go with the same speed.
Okay, okay, okay. You're okay with the class. You're not bored. That's why I'm asking. I think only one case we have discussed. Baki, we are discussing the related part. Panchavalkala Leba. Yes, it is very good. Okay, you can see. Okay, the same case. It is also mentioned as dadru. We can also take it as dadru itself. But the modern point, it is different. It is tinea. Why it is called pedis? Why it is called pedis? Tinea pedis, tinea cruris area. Okay, same. Please see the lesion. It is same, somewhat same. Erythematous lesions, vesicles are there. And here also, according to my experience, here along Nimbadi is good. Tribala Churna, Tribala Kashaya wash is very much effective. Tribala or Nimbapatra Kashaya wash. Nimbapatra means you can take Nimbapatra, you can boil it. Toya. Nimbapatra Toya is very much effective. Okay, Guluchadi Kashaya is effective, Manjishtadi is effective, Panchatikta is. I have given three different medicines in different condition according to the patient. All these three Kashayas are effective. And rather than Sorset, I have got good results in Gandhaka Malahara and 6C ointment. Gandhaka Malahara and 6C ointment is very much effective in these conditions. You can tell your own options. And Kaishwara Gugulu is good. Rather than Vilwadi, Kaishwara Gugulu is very much effective here. Tribala Churna is more effective here. Okay, in my experience. Clear? You're getting? Can we move forward? You are having any other options? Grab ointment. Okay, good. Nimbarajanya Kshalana, it is also good. Normal Nimbapatra Kshalana is very good. Toya. Prepare Nimbapatra. Okay, in 1 liter you can make a Nimbapatra Toya. Just boil it, and it should not be warm. That's the problem. Why? Because it is a important area. Please check it. Tinea capitis. Gandhagarasayana. Yes, it's very much effective. Tinea capitis. How many of you have seen? Okay. I think you have seen. Okay. Ringworm of the scalp. In these conditions, okay. Kadrarishta. Yeah, Kadrarishta can be given in this, dadru in Tinea cruris you can give. Capitis also you can give. Male, most frequently in black females. Okay. It is spreading through direct contact with infected fomites. You are knowing fomites. The other, what is fomite? The kerchief, like that. Okay, all the clothes are like that. All these are called fomites. Clear? And can spread through contact with infected cats or dogs. So those who are having pets, please listen. Please mention these points. Utensils, all the things, it is coming under formats. And it is having non-inflammatory, inflammatory, black dot, and phase type. 4 types are there. Non-inflammatory, I think it is easy to treat. Okay, small papules. Inflammation is the problem. Inflammatory, it is very much infectious. It is very much problematic. Crusty patches are there. Black dot, sometimes it will be infected areas of scalp. Okay, with breakage of hair shaft is there. Favus, patchy area of hair loss with yellowish crust is also there. How many of you have seen? What is this condition in Ayurveda? How many of you have seen this? Yeah, Nimbapatra Toya Vakaha can be good in cruris. It is good. But it should to be it should not be warm avagaha. You want arumshika. Yes. How many of you have treated this? How many of you written it as? How many of you got this? Rarely I am getting. It is not so common, but I am getting. So which is the medicine that you are giving for this condition? Why it is called arumshika? Where it is mentioned? Kabale. Kabale kleda bahula. Pittasrik. Okay. Kabapitta is there. Sleshma jandubihi. Pitta kabarekta. Kangu Siddharthaka Niba Pitika Sure Arimshika. I think it is there in this sloka that you are getting. Clear? Yes or no? It is mentioned in Ashtangradya Kabala Roga in Shiroroga itself. No, alopecia, it is not confused. It